What's going on, guys? This is Ben. Right now I'm on days off and I'm gonna do some preventive maintenance in regards to my lower back, which is why I'm with my good friend and my massage therapist, John Ray, over here at Greater Therapeutics. Now, a lot of my subscribers, they're men, age ranging from 25 to 35, 40. That's the demographic. Lower back pain. We're gonna fix it, and then after that, we're gonna prevent it. Number 3, stretching. Stretching, it's important. The thing about it is a lot of people, they neglect it. They'll do the traditional, like hinges, toe touches. They need to be doing more. That's flexion, but we need extension, then we need rotation. So a video will be up about lower body flexibility and hip mobility. Number 2, we have to strengthen up the glutes. Guys, I can't stress to you enough how important it is to get that leg and that glute work in. The reason why, guys, is because when you have weak glutes, it is going to affect you in the long run. Guys, I talked to my old timers that say, well, once we get the sciatica pain, it's gonna be there for life. That is cap, that's false. The reason why is because you need to take the time out in order to get the work done, straighten up the glutes, and then you're going to find that the pain is going to lessen, and after that, it's going to go away, providing that you're consistent. Number one is going to be throughout your journey as you're doing your due diligence, stretching, going to the gym, making the glutes strong. While you're going through that period, you're going to need to have a massage therapist work on the deep tissue as well as soft tissue.
Yeah.
Okay. And by doing that, your massage therapist will be able to work those adhesions, work those tissues in order for you to continue to train with lessened pain, and then the end result is going to be a more functional you. Let's get into this. John, what do you usually see, brother?
So typically when it comes down to lower back issues, we got a lot of the different kinds of things that go on. Typically in the hip, we're gonna see that the quads actually play a major role when you're talking about any kind of lower back pain, any kind of tightness in the glute, anything that might cause any kind of forms of sciatica. Now with forms of sciatica, I mean, you're talking like a pain that is either numb or dulling all the way down the leg and can sometimes actually go up to the lower back. Now, different forms of sciatica can affect people differently. Not every body is built the same. If you see our figures, you can tell. So typically we're gonna be pre-diagnosed to lean one way through our genetic disposition. So when we're looking at genetic disposition, my physiology isn't going to be the same as his, and just the same thing as anybody else who walks through these doors. They're all going to be different, and it takes us expert to kind of figure out which way to go and which route to go for every single situation that walks through or is experienced by the client. So anywho, so that's a little bit about what I do. A little bit more is I've worked with Grammy Award-winning bands. I've worked with professional athletes. I've worked with just, everyday champions, weekend warriors. So anything, you gotta find someone who is gonna fit your needs. I mean, not everybody's gonna be this kind of guy who's hitting the gym every single day as hard, like 110%. Some people, they need a relaxation massage. And they just, all they need is their body just to be recovered because they're not tearing it up every single day and trying to get ready for competition. Remember, when you're looking for somebody, you got to go based off of your needs and your genetic disposition. So we're going to be working on the leg. We're working on the quads. Now, everybody always asks me, hey, John, why are you working on the quads if I'm having glute issues? Well, the crazy thing about the quads, right, is you're going to have 4 muscles. So you got vastus medialis, vastus intermedius, vastus lateralis, rectus femoris. All of these muscles here, they kind of play a big role when we're looking at any kind of hip mobility and an issue because they all connect to the different areas of the hip at this point. When we're looking at it, the different insertions are going to cause more tension to the tensor fascia latae, which is right here on the side of the glute. Tensor fascia latae holds the kneecap in place. So if we're looking at it from a whole, your whole quadricep is connecting to your hip. Then if it's tight, it's going to pull on this tensor fascia latae, pull on the kneecap. Not only that, the tensor fascia latae is right next to the glute medius, maximus, and minimus. So all of this will then get tight, tightening up the piriformis, which is another small muscle. Now the crazy thing about the piriformis is a small little muscle, and it lies over the the sciatic nerve. So with that sciatic nerve, when it gets tight, pushes down, and it sends out that numbing feeling that you're gonna feel. And that's when you won't get the more flexion out of it. So what we wanna do is we want to look at the body as a whole. Remember, the body is a global unit. A lot of people, what they like to do is they like to localize the pain and say, oh, this pain is just right in this area. No, sir, it involves a whole structural body. And in a structural body, one portion affects another. So when you're doing your recovery, when you're working with someone, make sure that they're not localizing the pain and just working that one area. You want them to work the entirety. So that even though it's the glute and we're working the quads, even though it's the back and we're working the quads, we're still affecting the affected area. The affected area is still getting the work done that it needs, even though we're not directly touching it. I've had so many clients in my time that when they come in and we're working, they're like, hey, I don't understand this. I end up working on the quads. They end up getting up and they're like, my back pain has reduced by 60 to 70%. Now, with that being said, you can kind of see the importance of kind of stretching these other areas that you may think may not affect your where the tightness is located. So then that way you can kind of see that the body as a whole, and once you figure that out, bam, you're gonna get the results that you need. So right here, again, this is the origin. The insertion point for all the quads is the tibialis anterior. And so, just like that, we get better flexibility. All right, so we have a tight adductor right here, and different things require different modalities. And so what I'm gonna be using right now for the adductor that we're looking at is, first off, I have a little massage gun. This massage gun's really cool. Has a feature where it doesn't even move and it cools. So I use it as a cooling gun to kind of reduce the inflammation. So right here, there's like a ball just about this big, like it made you look, no, I'm just kidding. So it's about this big, right? And so we're gonna use the cooling massage gun right here to kind of bring down that inflammation, right? So we're working on the inflammation, we're going down. And how's that cooling? Is it good? Yeah, boom. Easy, easy, easy. So as soon as this thing is finished cooling, it's gonna bring down that inflammation, and immediately we can kind of already feel the ball like loosening up with the cooling. Now remember, when you're doing cooling, doing any kind of cold therapy, cryotherapy, you do not want to do it for more than 12 minutes because then it actually increases your injury time. So if anybody does ice therapy with you, again, no more than 12 minutes.
Okay, so John, you said that over 12 minutes of cryo or ice therapy, it will increase the recovery time, correct?
Yes, yeah. So that means you're going to be injured for longer.
Right, okay. So for those who would put an ice pack, let's just say, on a body part that is inflamed or that has just been recently injured, about how long do you recommend that they put the ice pack on for?
I would recommend increments of 8 to 10 minutes. And then doing heating, right? So you're gonna put the ice pack on for about 8-10 minutes, take it off, put heating for about 15 minutes, any you can. And the cool thing with heat is you can have it on as long as you want. Cold, you don't want it as long, because what it'll do is it'll constrict the blood vessels, and then it'll just keep constricting, and then it reduces blood flow. Whereas if you constrict it for a little while and then you open it up, it increases that blood flow and increases that circulation, and that's what we want. When I first heard about that, I was like, what? Like, yeah, but that is true. Ice does, in fact, increase your injury time. So, ice for 8 to 10 minutes, keep it safe, and then move on over whenever you're ready to heat, and be there for about 5 to 15 minutes, and then come back into icing, and you're gonna be great. So now we've cooled it down for a little bit of about less than 3 minutes, and you can already feel the relief. Now we're gonna move over to heat.
Oh wow! So that gun both cools and heats.
And there you go. Kind of.
What?
So I'm gonna put it on the medium setting, and immediately you can feel the heat.
Yes, guys, this is very warm. I've never seen this gun before. This is the first time they actually used it on me.
So the cool thing is when you choose your massage therapist, you want someone who really loves what they do. You want them to be trying to innovate. Just as a practitioner, you're practicing. You're constantly trying to grow and trying to figure out what's going to give your clientele the best relief. And me working with a lot of athletes, I'm always looking for ways to bring cryothermotherapy, myofascial decompression, which is other known as cupping, to my clients. And you see, the thing is when you're looking at a global issue, this could be the root problem for his tight glute, and then that can be the problem for his sciatica, because there is a huge knot here, and if we just worked on the glute and not look at the global issue, we might have not found this, and then this could be the culprit. This exactly could be the culprit of his issue without him even realizing it. Sometimes secondary issues are the primary issue.
What type of athletes do you usually see that would have an adhesion here?
So here you're gonna see it in a lot of runners, because you gotta think about it when you're pushing down. Like even when you're squatting, when you're deadlifting, that's when you're deadlifting more is when you're primarily gonna feel that. The squat, not so much, because the adductor pulls more towards the hamstring with this specific issue. Now, sometimes the adductor, it'll be with vastus medialis, but not in this case. Your case is pulling more for more in your deadlift.
Okay.
So again, you're gonna feel it more on your sprinters who have, who dig their heels in. Let me think about who else. That's mostly it. I think honestly with powerlifters, sprinters, football players, soccer players, basketball, anybody who kind of runs and has like a sprint action to it, you're gonna feel this.
Okay.
And just like that, look at that.
Wow.
And that's what we want. So another thing to do whenever you have issues with the quads is what's called tuck-swan therapy, which is hammer therapy. Now, I don't have these fancy hammers or nothing, but I work on the origins, and if there's anything that I feel it's a little bit more tight, I kind of force the fascia to kind of move a little bit, and this helps increase range of motion. And for those stubborn knots, sometimes it pulls it out a little bit easier, because sometimes those stubborn knots just don't want to move out, and you gotta force it to stretch a certain way for a sporadic second, and then that loosens it up. And just like that, we're ready for the back. If the glutes are the issue, right? We got sciatic. The piriformis lies right here. And again, piriformis, there's a nerve that comes down right here, and that's called the sciatic nerve. And right over it is the piriformis, and it's a very small muscle. So boom. So when all these muscles are tight up here, when the quadratus lumborum is tight up here, when the hamstrings are tight, right? We have all these pulling right here, and the tensor fasciae latae is tight. All of these things right here will begin to get tight, and it'll pull on right here. And that's where the sciatic nerve runs. The sciatic nerve also comes up to the lower back very slightly. And so if, again, you're trying to work the sciatic issue, you want to be able to do a full form factor of it. So again, our hot spot is going to be the hamstring, it's going to be the lower back. Again, most people are just going to focus on one area, but you can't do that. You have to work the body as a whole. Remember, global issue, not local issue. What may seem local is actually a global. So when you're working with somebody and you lay out, you're saying, hey, massage therapist person, my lower back hurts, and they're not doing a full assessment of anything else, well then you may want to address that and let them know exactly, hey, ask them questions. Hey, is this localized? Do you know if it's pulling from somewhere else possibly? Just to kind of help guide them. And sometimes, we all, as massage therapists, we can all be guilty of kind of ignoring the fact that these are global things. And we need a reminder of that. So kind of talking and, working with the person that you have to work with, you just want them to kind of be open to it. Make sure that they're open. Make sure that they're trying to improve. Make sure you're choosing the right person who is trying to improve and not trying. There's a lot of massage therapists that will look at you and they'll be like, oh, you know what? Let me see how much dollars I can milk out of him. Let me tell him he needs to come in for X amount of sessions. And that's not the issue. What I found right here in this issue right here. What I found right here. There is a small adhesion on the, I guess it would be, this is going to be the quadratus lumborum thoracolumbar aponeurosis. And what I feel right here is I just feel a slight adhesion. And so what I'm going to do in this situation is trigger point therapy. So I'm going to do a hold. I'm going to put pressure on the hip. And then we're just going to leave it there for a few seconds. And what we're doing is we're kind of putting pressure so that way there is a little bit more blood circulation in that area. And boom, and then it opens up. And just like that, gone, right? Yeah.
Right.
So, again, try to find someone who wants to view massage therapy as a preventative care therapy, not as you don't want them to treat it as a magic pill. Because there is people who will say that you're required to come in every month, every whatever. No, there's different ways, and you gotta find out what works for your body. Sometimes it's gonna be stretching, and you may only need to go see a massage therapist once every 3 months. Sometimes, some people who tear up their body a lot and they're consistently growing and their body needs to be torn up, they need to see a massage therapist more frequently. But it's always a need base. And don't make it a requirement base. And if they try to, then chances are they're probably trying to milk you. Don't let it happen. I always try to increase knowledge with my client and try to show them, hey, be somatically aware, which means having an understanding of your body, understanding what your body needs, because again, everybody is different. So now we're going to work the glute. Okay, so now what we're going to be doing is we're going to be attacking the glute finally. So what I do is, for my typical glute treatment, it's very simple. We've already worked the quadratus lumborum, we've worked the hamstring. Now we're going to come down here and we're just going to kind of see how the work has affected. And already I can feel an immense relief of pressure just from the work. And that's because we hadn't even worked on the glute. So now we're actually working on it, it's loosening up even more. What I typically do to find the piriformis is I put my hand on the sacrum my palm, and then right here about where my index finger is, there's a little line, and it always lands perfectly on the piriformis. And then boom, I apply the pressure with my elbow, and we're gonna do 10. 1, 2.
Okay. Well, guys, I hope that you enjoyed the coverage. So remember, number 3, stretching. Number 2, making the glutes stronger in order to prevent the adhesions from occurring more often. Number one is going to be preventive maintenance, soft tissue, deep tissue therapy. I can't stress it enough, guys, how important having a good massage therapist on your team is. John?
Yes. Focusing on stretching is really great. Focusing on your maintenance with physical therapy and, making sure all your muscles are in alignment, and as well as making sure that they are balanced is phenomenal. And then finally getting a massage therapist who can work with your body and understand you for your needs. Absolutely. This is a perfect thing, and this is a perfect regimen. It's what makes a champion a champion.
Okay. This is Benjamin along with John Ray from Greater Therapeutics. His information will be in the description below, and I think I'm going to edit it in to have his information on screen right now as I'm talking. This has been Benny the Ox along with John from Greater Therapeutics. Please like, comment, share, and subscribe. We're on our way to 1,000. Let's get it done. We'll talk to you soon. Peace.
Later.